are going to do a little presentation about COVID-19. There have been a lot of families requesting basic information to teach their children on different things about COVID-19. That way they can be more knowledgeable about what to do in order not to spread the virus. I'm here with my entire family. This is Leah. That's Dr. Henry Katanga, my dad. That's Leilani. That's Nathan. Right by his side is Jesse. That's Sam Jr. And Princess is the one right there doing the video. So Dr. Dinjakat, my husband, is going to do the presentation, and please listen carefully as your attention will surely save lives. Thank you.
Okay, this video is about coronavirus. So coronavirus, I think the word coronavirus is the most searched word in Google. And of course, this presentation is going to start. The first part will be for us to understand a little bit what is coronavirus. And then after that, we are going to talk about how can we play our own part in order to avoid spreading coronavirus. And coronavirus, it was normal to say, oh yeah, you had coronavirus, just like you say you have allergies, or just like you say you have common cold, right? So, but today, you can see much faith. Now we became aware of the new coronavirus, and my hospital started now trying to distinguish what kind of coronavirus it is, and you can see that this patient had a coronavirus, which is the regular coronavirus. So in December of 2019, that was when China, the new coronavirus started in China, and it was in December that they found patients with pneumonia, and they didn't know what was the cause of the pneumonia. So China reported to the World Health Organization about the virus, and by early January, they already had 44 cases of patients with coronavirus. So the disease is called coronavirus disease, and because it started in 2019, that's why we have the word COVID-19. So we're not going to spend more time on that. I want to go into how you can get coronavirus. So in the social medias and in the news, we are hearing so much about the distance. So if you look on the slide there, you're going to see the distance. They talk about 6 feet. So if you stand 6 feet closer to another person who has coronavirus and they sneeze or they cough, when they sneeze, it comes up in the form of droplet, almost like you sprinkle water and it goes in the air. And if it lands on you, on your hands, and you touch your lips or your nose, it can go from there and get into your lungs. So you can see nose, it can go through the eyes. In the eyes, it goes through the tear ducts to connect back to the nose. And that's the primary source how it gets into the body. So the slide here is very important in that it is through cough, sneezing, and you get the droplets. Also, it can remain on different surfaces. That's why you will see as we move ahead about washing hands. It can remain on plastic, it can remain on countertops, and it says that on metal and plastic it can go for 3 days before it actually dies. So the clothing, that's one that we have been talking about. My wife will talk about that. Many people who are looking, that's a new research. Nobody is talking about clothes that it can spread, but I still believe that it can spread through clothes. It is droplets, not airborne, but there's a new research talking about that it can stay in the air for half an hour to about 3 hours, meaning that if I had coronavirus and I sneeze around this area, it can linger up to half hour to 3 hours before it disappears, which means that if somebody was around there, you can pick it up. This is very important because many people think that, oh, I am not sick. Some people will actually get infected with the virus, and they might end up not having symptoms. Or you might have it for a long time before you even know you have it. So it goes from 2 to 14 days. And you can see that from day 1 right up to day 3, that is when you are just infected. Then you start shedding the virus, meaning that you can now, from day 3, you can have people, you can already spread it to other people without even knowing that you have it. And the symptoms start at an average of day 5. So that's why the quarantine of 14 days is important, because if you are exposed, they keep you for 14 days to see if you have it. So what happens if you are exposed to the virus? If you are exposed to the virus, let's say I touch this chair and it's on there, I touch my nose, it gets into my nose. The nose have cells which we call epithelial cells. So it penetrates, it have receptors that will connect to the cells of the nose and then start multiplying and then take over those cells. The lungs or the respiratory tract is divided into 2. We have the upper and the lower. So some people might end up just having light symptoms, and that's why they say stay at home. The light symptoms one will be the upper respiratory, where you will have probably just cough, fever and ache, but you might not have serious shortness of breath, which is in the lungs. So they say stay at home, don't go to the hospital, because we want to keep it for those who are seriously sick. So what if it now gets into the lungs? That is how it was actually discovered in China, because people were having pneumonia. So the complication of having coronavirus is pneumonia. And so if you have severe pneumonia, you see it goes through, let me talk about this area, around your throat. It stays around the throat for around 3 days. That's why in Africa and other places they're talking about drinking warm liquid. Why it is around your throat, if you gargle, you might help get rid of it and preventing sore throat. But once it goes through the windpipe or the trachea and get into the lungs, that is the area we are going to look a little bit. If you look where I'm pointing on the left, that's a normal airway, air space. On the right, you can see that it's just a small hole because it has been infected. And this side of the lungs here, they're infected, and you can see that it's not open, because you want to have open space for oxygen to be able to penetrate from the lungs vessel into the blood vessel. So what happens if that cannot happen? Oxygen will not be able to move into blood, and you will not develop what is considered acute respiratory syndrome. So let's look at who is at risk. So we want to know those that are at risk. If you don't have any condition, you always hear of the word pre-existing condition. If you don't have any, if you are a healthy person, your chances of really having or catching it or even dying from it will be very low. But you can see you go from cancer at 5.6, hypertension 6, chronic respiratory conditions, diabetes and cardiovascular seems to be the highest. So that is really surprising. So if you have family members with diabetes, high blood pressure, you have to take this very serious. So risk of dying from it, though the elderly, which because they already have those pre-existing conditions, when you get older, you always have something going on. But it does not mean that young people cannot have it. And if you cannot, you can also have it, but you will be what we call super carrier. And you take it home to your grandma, grandpa, and mom. And when they get infected, they get the symptoms, but you might be carrying it without knowing that you have it. So this was like 1 week ago. You can see the numbers in China, more than 80,000 cases by then in China, and 3,200 died from it. Italy, the number is no more just this number now, but you can see in Italy people are dying from it more than any other place. In South Korea, 8,000 got infected, but only 70 people died from it. So this is something many researchers are studying. What did they do that they did very well? So in the United States, on the 14th to the 15th, 4,459 were tested positive and 86 died from it. But you can see the number changing almost by minute. From that number that we mentioned, you see from 4,000 on one day, by the next day we went up to 6,000. And today, March 19th, 2020, 11,000 people have been tested positive in the United States alone. This graph is important because we need some encouraging news also. You can see in China, it started in January and was just going so high, and it peaked at that number and then started dropping because the social distancing, you will hear this word, is very important. That is why we're staying home. They're saying stay away from others, maintain a certain distance, because that is what China did. They built emergency room, they quarantined people and washing hands, sterilizing the whole place, and that's what helped. Look at South Korea. They did the same thing. It started in picking up, it took off in February and picked up before March. It dropped down to 0. So this is where the concern is, to really tell you to understand, those of us in the United States, those of us in Africa and other places that have not yet had it, we don't want to follow. The blue here is Italy. All countries, they are trying not to follow the trajectory of Italy. You can see United States in orange following that trajectory. Iran is bending.
Your cursor is not showing.
Okay, Iran is bending, where you can just look at Italy and you look United States in orange, Iran in pink. We don't want to follow Italy. We want to see if we can follow South Korea in green and start flattening the curve. Of course, the Singapore and the other will actually be the best. So, my cursor is not showing, but so on the next one here was is just showing the same thing that I already mentioned on there. So we're not going to spend time there. This is United States, and for those of us in the United States, many of us are taking it lightly. Kids are spring break. They're all at the beach in Florida and many other places. Many young people think that we cannot have it, but look at what is happening on here. You see it keeps going up and it's still going. Today is 3/19/2020, so we have to do our own part, and the goal is that we want to make it look flat. You can see the dotted line. The goal, the social distancing, is that we want to bring it down so that we can contain it. Now, if we don't do anything at all, this is also encouraging news. The belief in immunity, which is called the herd immunity, is that with viruses, if you don't do anything at all, at some point, if you look on there, the blue, it says that there is no immunization. But when people get infected, as you see on the first picture there with the arrow, is that you will gradually develop immunity from it. And the last one at the bottom shows that the herd immunity is, if you don't do anything at all, the encouraging thing is that nature will take care of it. So we should, if you are Christians and believers, keep praying that we should get to this point as soon as possible. But if we don't get to that point and you end up in the hospital, you can hear United States, the word ventilator machine is a word that governors, healthcare providers, they're asking for it. They're buying many of them to keep, because when you get to severe form, you will be intubated and you will have a tube and it connected to the machine to provide oxygen. So the most important thing we need to know is that what can we do after getting all this information? There are many questions. We will try to answer as few of the questions based on the Center for Disease Control and Prevention in the United States, and also based on the World Health Organization. I will ask Leah, you're going to read the first one. How should I greet another person to avoid catching the new coronavirus?
To prevent COVID-19, it is safest to avoid physical contact when greeting. Safe greetings include a wave, a nod, or a bow.
Okay, thank you. Princess, should I avoid shaking hands because of the new coronavirus?
Yes, respiratory viruses can be passed by shaking hands and touching your eyes, nose, and mouth. Greet people with a wave, a nod, or a bow instead.
Thank you. Junior, is wearing rubber gloves while out in the public effective in preventing the new coronavirus infection?
No, actually, washing your hands offers far more protection against COVID-19 than just wearing gloves. You can kind of still pick it up due to contamination that could be on the gloves, whether it be outside, whether you take them off, or maybe inside after you're done with whatever procedure you finished doing.
That is good because when you have it on the gloves, you can touch your face. Naturally, we touch our face and our nose without knowing. So that means that wearing gloves will not actually protect us. Nathan, can you see that this is not a question? How do we prepare for coronavirus? Just read what you see.
Be ready for #coronavirus. Be safe from coronavirus infection. Be smart and inform yourself about it. Be kind and support one another.
Thank you very much. You see, so we should not make it a stigma. You might be living in a community where we already have somebody who has been tested positive. So the most important thing is that do what is right. Being safe means even though you are helping, do all what your healthcare providers, the local authorities are telling you. And also be kind. Don't make fun of the people who has coronavirus. Let's be each other keeper. So, Jesse, can you read the next slide for us?
Be smart if you develop shortness of breath. Call your doctor, seek care immediately.
Thank you very much. So also again to remind you, so when they say contact your doctor, so now you can contact your doctor through the phone. We now have what is called virtual consultation, so you can also, a doctor can see you while you are actually at home, which is a form of telemedicine. Who else? Leilani?
Alright. Be smart and inform yourself about the coronavirus. Follow accurate public health advice from WHO and your local health authority. Follow the news on latest coronavirus updates. To avoid spreading rumors, always check the source you're getting information from and don't spread rumors.
Thank you very much. This is very, very important. We know a lot of conspiracy theories out there, a lot of information that have not been proven. Please be careful and use what we already know. So, Leah, can you go ahead and read what you have on there?
Be safe from #coronavirus. If you are 60 and up, or if you have an underlying condition like cardiovascular disease, respiratory condition, and diabetes, be avoiding crowded areas or places where you might interact with people who are sick.
Thank you. So we talk again about being kind, that we have to be each other keeper. We have to help one another, checking on your neighbors if you don't see them. If you have any information that is helpful, we are encouraging each and everyone to share it and help us so that we can all fight this together. So, share the latest facts and avoid hyperbole. We've already talked about that, and that we should be each other keeper. And if you have any stories, we're really grateful. Many people are sharing videos. Those that were in the cruise, they have been sharing information that have been very helpful to the government. So washing hands is huge, and it's very important. We are going to come to that. But as we say that we have to show empathy, we have to learn. If you have information, you should share. You should adopt safety measures as you're going to see. So you can even wash your hand 100 times. There's a slide here that I want to show you about when to wash your hands. Leah, go ahead and read that slide for us.
Can you make it bigger, please? Okay, go ahead, Leah.
Can you read, Leah? Go ahead and read.
Protect yourself and others from getting sick. Wash your hands after coughing or sneezing. Wash your hands when caring for the sick. Wash your hands before and or during and after you prepare food. Wash your hands before eating. Wash your hands after toilet use. Wash your hands when hands are visibly dirty. And wash your hands after handling animals or animal waste.
Yes, so even if you don't wash your hands and you have sanitizers, when you sneeze, use your sanitizers. If you move around and touch places, wash your hands or use your sanitizers. How about using tissues? Now you remember you can sneeze on the tissue, you fold it, put it on top of something. What you see on there, that is not the right way to prevent the virus. So you have to put it in a trash can that is covered. You don't throw it on the floor. You throw it where another person will not come and step on it and spread it. So Princess, can you see that? Avoid what?
Close contact when you're experiencing cough and fever. Avoid spitting in public. If you have fever, cough, and difficulty breathing, seek medical attention.
All right. Okay. Thank you very much. So this slide here is very important. We say we can only get through this by being together. So I want Leah to come closer and read everything you see on the slide. So we start, how do we help cope with stress during this time?
It is normal to feel sad, stressed, confused, scared, or angry during a crisis. Talking to people you trust can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including proper diet, sleep, exercise, and social contacts with loved ones at home and by email and phone with other family and friends. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to a health worker or a counselor. Have a plan where to go to and how to seek help for physical and mental health needs if required. Get the facts. Gather information that will help you accurately determine your risk so that you can take reasonable calculations. Find a credible source you can trust, such as World Health Organization website or a local or state public health agency. Limit worry and by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. Draw on skills you have used in the past that have helped you to manage previous life, and use those skills to help you manage your emotions during the challenging time of this outbreak.
All right, so Princess, can you read how to help children cope with the during this time?
May respond to stress in different ways, such as being more clingy, anxious, withdrawing, angry or agitated, bedwetting, etc. Respond to your child's reactions in a supportive way. Listen to their concerns and give them extra love and attention. Children need adults' love and attention during difficult times. Give them extra time and attention. Remember to listen to your children, speak kindly, and reassure them. If possible, make opportunities for the child to play and relax. Try and keep children close to their parents and family, and avoid separating children and their caregivers to the extent possible. If separation occurs, hospitalization, ensure regular contact via phone and reassurance. keep to regular routines and schedules such as much as possible, or help create new ones in a new environment, including school/learning, as well as time for safety, playing, and relaxing. Provide facts about what has happened, explain what is going on now, and give them clear information about how to reduce the risk of being infected by the disease in words that they can understand depending on their age. This also includes providing information about what could happen in reassuring ways. Family members and/or child may start not feeling and may have to go to the hospital for some time so doctors can help them feel better.
Thank you very much. So for food safety, you have to do everything. Eat well-cooked meat, and if you can reduce, the World Health Organization is also advising, if you are cutting raw meat and you have one knife, you have to try to wash it in warm water, or if you have multiple knives, you can use a different knife for cooking and a different knife for serving the food. So for those in other areas like Africa, now that we're getting the virus there, so the advice from the World Health Organization is to stay away from sick animals and don't eat animals that are dead. They might be dead from the virus, so very important. So avoid touching your nose, your mouth, your face as much as you can. And of course, if you have animals around you this time, they too can move into areas, and when you touch them, after that you have to wash your hands, sanitize your hands as much as you can. So we also have to do our best by disinfecting the house, the tables multiple times now. In this house, Princess is in charge of wiping the doorknobs every day and wiping the countertop. So please, the advice is that you should not overdo it, because you know all those chemicals that you are using, you can also overspray, and you can inhale some of those chemicals, and that might not be good for yourself. So practice safety, read the instructions that you see on all the chemicals that you use, and follow the right instruction. So if you are traveling, you have to make sure it is really necessary for you to travel. Follow the guidelines of the World Health Organization. Check and make sure that where you are going, that there is no travel restriction. So now many people are being stranded at the airport, especially in Africa. If you are traveling to Cameroon right now, you will be, when you get to the airport, you will be quarantined there, and you will be there for 14 days. So if you travel, make sure you know what is out there. Get all your first aid with you, and make sure you are well informed. United States is not allowing U.S. citizens to travel, even as of today, requesting that if you are out of the country, you should turn back to U.S. as soon as possible. Of course, these are extra information about where to sneeze. Sneezing in your elbow is the best recommendation for now. I think this is the end of our video. We want to thank you for listening, and we continue to say God is in control and God is going to watch over us. Do your best. Knowledge is very important, and if you have any information, please share. Thank you. God bless you.
Thank you very much. Just a very short question. Junior, what advice do you have for teenagers who are out there now thinking that the virus is not going to affect them?
Oh, wonderful. First of all, this isn't about you. This is for the sake of those who are immunocompromised. So yeah, we're young, we're fun, we can get it and be perfectly fine after a couple of days. But for the sake of those who may not be so fine due to other health complications, stay home. Spring break isn't worth potentially killing several people. Common sense, please.
Thank you very much. And Leah, how do you feel about staying home and doing homeschool learning so far? How do you feel about it?
It's fun, I guess, especially whenever I make Play-Doh.
Okay. Do you have anything you want to say to people around your age?
That you should really stop making jokes about it because it's not funny, because people are actually dying and suffering from it, and you should be serious about it and wash your hands every day.
Okay, I'll leave the final question for my dad, Dr. Henry Tatanga, who hasn't spoken much in this video. What do you have to say, especially to people around your age?
I want to say to people around my age that they are at greater risk than other people. And for everybody, do not wait so that you can contract it and develop immunity. You may not survive it.
That's true.
Thank you.
Thank you very much. Thank you, everyone. You all did a very good job. Thank you, Dr. Dinjakat, for taking the time to come up with this PowerPoint, and I believe it's going to help a lot of people. Thank you.